Hi, I'm Dr. Rahman, and let's talk about bacterial vaginosis, BV. BV will present as a vaginal discharge, often with a foul odor. Women sometimes describe it as a fishy odor, and it's really the odor that brings you to the office, which is unlike a yeast infection. We talked briefly about a yeast infection. A yeast infection, you tend to be more symptomatic with itching and irritation and swelling of the skin on the outside surrounding the vagina. Not so much with bacterial vaginosis. Bacterial vaginosis is not considered a sexually transmitted infection. It occurs whenever there is an overgrowth of bacteria in your vagina. Now, every woman has bacteria in her vagina, just as every woman, every person has bacteria in their gut, which is called the microbiome. Well, you also have bacteria in your vagina. So having bacteria isn't the problem. The problem is when there's an overgrowth of bacteria, which is why some women will take probiotics orally or sometimes probiotics vaginally to limit the overgrowth of bacteria. If you've been watching me for any length of time, you know that my first option is not to take a pill. My first option is to tell you to watch what you're eating, to limit the sugar. And sugar is placed in a lot of ingredients that we don't normally think of as containing sugar. So I'm not just talking about added sugar. I'm talking about sugar that you'll find in baked goods, bread, sugar in soft drinks, fruit juices. You really want to limit your sugar intake. That's the first thing, and see what happens. Sometimes it's necessary to take antibiotics, and there are antibiotics which are effective against bacterial vaginosis, but who wants to have to take antibiotics all the time? And we know that sometimes using antibiotics can predispose you to developing, you know what, a yeast infection. So let's try to avoid antibiotics. Let's watch what we eat. Let's limit the overgrowth of bacteria in our vagina. Now, some women get confused and they call BV yeast and they call yeast BV. And when they go to an urgent care center, they get treated for both presumptively. I'm saying better to know what's going on, better to take control of your health. And that's what I'm trying to help you to know how best to manage your health. And this is me, Dr. Rahman, from Today's Woman. I look forward to talking to you real soon.